Hi, my name is Miguel Gomez. I'm the director of AIDS.gov, and I'm really lucky today because I'm speaking with Lisa Neal from the Indian Health Service, who's done a tremendous job there, and I know you have some important news for us. But first, tell us about the resources at the Indian Health Service for those responding to HIV.
Well, we actually have quite a lot, and the most obvious one is our extensive website. It is at ihs.gov/HIV/AIDS, and it has a really wide range of resources both for providers and for the public who are interested in either preventing HIV transmission or improving care to those who have HIV already.
And you also have just a new announcement that just came out recently about some resources available to the community. Can you share that?
We do. Through a partnership we have with the CDC, it's a 5-year RFA that is on the street. It is due August 28th. And what it does is it allows tribes and tribal organizations to propose for a 5-year chunk of funding to improve HIV services or retention or prevention in their community. So it's a very broad range, and it's very exciting because it further increases our portfolio specifically controlled by tribal communities.
Oh, wonderful. So, Lisa, we've talked about HIV, but you've also done some really powerful work when it comes to viral hepatitis. Could you tell me a little bit about that?
Well, IHS has been involved in the viral hepatitis response from HHS, and a big part of that, the most measurable part, has been that we've screened now more than 40% of all of our baby boomers that we serve.
Wow, great.
Yeah, and then also we provide every 2 weeks we have a conference call for sites interested in treating hepatitis C. So we get real-world consultation live with sites so that they can have that support to either provide the appropriate care in-house or to refer if the patient requires other care that they can't provide at the local level.
And I know that's just a highlight, but thank you. I would love for you to share, you have some real exciting news about what's happening with you within the Indian Health Service. What is that?
Well, I'm changing jobs. I'm moving from the HIV head within the Office of Clinical and Preventive Services and moving over to be a public health advisor in the Office of Public Health Support. What that effectively means is I'm going to be leading the Tribal Epidemiology Centers, which is a network of 12 centers throughout the country that provide technical support, research leadership, and overall epidemiology services to all of Indian Health Service.
They are so lucky to have you, and on behalf of all of us doing work on HIV and viral hepatitis, I want to thank you for building such a strong foundation and leaving so many resources for the work to continue. Thanks for joining me today. This is Miguel Gomez with AIDS.gov.
For IHS HIV information, contact Richard Havercat, Sault Ste. Marie Tribe of Chippewa Indians, richard.havercat@ihs.gov.